So, good evening, everybody. My name is Antonia Wunderlich, and on behalf of the British-German Association, I would like to welcome you to this online event. As many of you will know, we are a charity that promotes mutual understanding and good relations between the UK and Germany. Part of what we do is to support public education about Germany in the UK, so we regularly put on events such as this one, along with other initiatives such as our monthly newsletter with interesting Germany-related material. Tonight, we will be looking at the UK's and Germany's comparative responses to the COVID pandemic. This could not be a more topical discussion, with both countries currently in lockdown, unease growing around having to deal with the virus in winter, and news spreading of a possible vaccine by the end of the year. We are delighted to have three exceptional panelists with us tonight. Stefanie Bolzen is the UK and Ireland correspondent for German Welt and Sunday edition Welt am Sonntag. She's been reporting extensively on COVID and will chair tonight's event. Professor Matthew Flinders is Professor of Politics and founding director of the Sir Bernard Crick Centre for the Public Understanding of Politics. He is also president of the Political Studies Association of the UK and a board member of the Academy of Social Sciences. Professor Flinders will be talking in particular about the UK's response to COVID. Professor Anna Holzscheiter is Chair of Political Science with a focus on international politics at the Technische Universität Dresden. Parallel to her professorship at the TU Dresden, she heads the research group Governance for Global Health at the Social Science Research Centre, Berlin. Professor Holzscheiter will be talking in particular about Germany's response to COVID. Before handing over to Stefanie Bolzen, a quick note on the technology. There will be a Q&A session after the discussion, and the Q&A will be conducted via the chat, so you should be able to see the chat icon at the bottom of your screens. If you click on it, you can start typing up and sending in questions, and please feel free to do so over the course of the event. So without further ado, I'd like to hand over to Stefanie Bolzen. Thank you.
Thank you very much, Antonia. Can you all hear me all right? Yeah? Okay. Yeah, thank you very much. I'm really looking forward to this panel discussion. Obviously, I've been following very closely the COVID pandemic in the UK, but for obvious reasons also back in my home country, in Germany. This week in the UK, we passed the sad mark of more than 50,000 people who have died of COVID-19. There's an excess death rate of more than 70,000 people. Today was another record of 33,000 new cases in the UK, but also in Germany, cases are rising rapidly. And while Germany and the UK in the first wave, as it's called now, went into lockdown more or less at the same time, Germany went into the first lockdown at a time when exponential growth of infections was much lower. And therefore, or maybe that's one of the reasons why Germany fared better, so to say, in the first wave. This has now actually changed. Germany is, and I'm sure Anna can talk a lot about that, in a much more difficult situation. And I'm very much looking forward. Matthew will start with around 10 minutes to give an idea of the situation in the United Kingdom. And then Anna will talk for 10 minutes as well. And then we are really keen to have your questions on the chat. And I very much hope that in the next 60 minutes, we will scratch beyond the surface of coverage of the UK and Germany. So Matthew, the floor is yours.
Okay, thank you ever so much. And yes, I mean, it is a very poignant day to be discussing this topic. A record number of new cases today, up 10,000 on yesterday. So a massive issue here in the UK. But I suppose one of the things I want to think about in order to frame a discussion is, how do we talk about COVID and policy responses to COVID as a separate identifiable issue? In many ways, what I want to try and get at is the way, particularly in the UK, COVID has never been a separate issue, but it's almost been layered upon a whole number of political and governmental challenges. So what I thought I would do in my 10 minutes is, first of all, talk a little bit about the context, and particularly how the feeling of the British public seems to have changed. And then I want to just highlight 5 themes or topics that I think have been particularly interesting in relation to understanding the UK, and that may also be interesting in helping to think about comparisons with Germany. So my 5 themes are, first of all, structures. The second one is trust and culture. The third stream is policy and stability. The fourth theme is accountability and blame. And my fifth theme is on leadership, which I think really is the critical issue, if that's not too obvious of things to say. But let me just say a few things about the sense of feeling. I mean, what's interesting in the last couple of weeks, I think there's been a distinctive shift in British society. It's been a roller coaster. 2020 was never supposed to be like this in the UK or anywhere. But what's happened recently in the last few weeks is there's been a growing public realization, I think, that COVID is going to be a long-term challenge. And that has particularly been brought to bear by Christmas. We've just gone into lockdown. It's due to end on the 2nd of December. And a lot of people simply don't believe that we will come out of lockdown in time for Christmas, or at the very least, they think we'll go into some other form of measures. Put very simply, we are not going to have a normal Christmas this year. And I think that has really brought it home to people and made people who are already possibly lonely or missing family and friends, it's really moved to another level. And particularly when the Chancellor announced the extension of the furlough scheme, paying people up to 80% of their salaries who are having to be unemployed because of COVID. When that was announced, it would be extended to next March, although welcomed by industry, it also sent a clear signal to the public that, gosh, this may well be a much longer haul than we expected. So let me move on to my themes, and I can only touch on these very quickly in the time that I have, but hopefully your questions will allow us to develop them in more detail. So the first one is on structures. What's interesting about the UK case is that the British political system is famous, or maybe I should say infamous, for being highly centralised. We have a winner-takes-all, power-hoarding model of politics. And yet what's really interesting about COVID is that having any clear policy response has been heavily hampered by a large amount of fragmentation, which has made it very hard to construct a coherent policy, because COVID stretches across not just all of the normal departmental lines of Whitehall, but now, of course, that complexity is layered upon forms of devolution. We could also say in terms of structures that what's interesting is that the British government have approached COVID, or at least they started off with a very top-down, formal, Whitehall nose-based approach. This over time started to generate more and more criticism until a month, 5-6 weeks ago, the Prime Minister was forced really to dedicate a lot more time, particularly to engaging with the English regions, where now we have regional mayors, the metro mayors as we call them. What was interesting there was that instead of really forging a new, fresh, positive approach, the attempt to engage at the regional level arguably simply opened up a political can of worms and pork barrel politics around what the different regions wanted and why some regions thought they should have different rules and regulations to other regions. The simple fact was we've always had a problem in the UK of the public understanding what the rules are. The attempt by the national government to engage particularly with the English regions increased that complexity and left many people confused about what rules they were supposed to be following and why the rules sometimes just down the road were very different. So structures, and what is the most appropriate scale for trying to deal with the crisis? The second issue I can deal with quite quickly, public trust, public confidence in politics. Unfortunately, the British government did not go into this crisis on the basis of lovely high levels of public trust and confidence that they could almost utilise as a form of political capital to get the public to go along with them and their policies. I've done very well so far. I've been talking for a few minutes. I've not mentioned the B word, the Brexit word. COVID hit a country that was already struggling from Brexistential angst. It had taken up a huge amount of energy, not just amongst the politicians and the civil servants, but just amongst the public generally. We were a divided country. Get Brexit done was what Boris was supposed to do. And suddenly COVID, we've got this whole new demand and a new layer of complications. The funny thing is, I don't know how to say this, but one of the interesting elements of the whole COVID drama was that one of the high points for the Prime Minister was when he ended up in hospital. because a rallying around the flag effect led to Boris enjoying a Boris bounce, but unfortunately it bounced or fell back down and further back down, and currently less than a third of the British public think the government is doing a good job. So public confidence, and particularly there's a generational divide here. Younger people in particular are increasingly resistant to trust the government and to follow the rules, and that is creating intergenerational tensions. Number 3, policy and clarity. In the UK, we have had what can only be termed a zigzag approach to policy. One step forward, one step back, one step up, one step down. We have never had any sense of a consistent, clear strategy or vision on COVID for where we're going or why. And unfortunately, that has been embarrassingly, symptomatically demonstrated in the chaos surrounding our track and trace system. This also ended up with our government having a policy, which I've described in my writing as hugging the experts, that suddenly no minister would appear without saying at least 10 times, we are following the science. The Prime Minister wouldn't appear without literally the Chief Scientific Advisor and Chief Medical Officer over his shoulder, flanking him like some altar at a church. But of course, that was great for the Prime Minister, because when the technical questions or the politically mischievous questions came, the Prime Minister could and did deflect them to the scientists either side. What's happened is that scientific sense of unity is fragmented and increasingly left the government almost exposed as the science fails to deliver simple solutions to complex problems. Very interesting today, the World Health Organization has come out just today in the wake of the announcement of the vaccine, saying the vaccine might be good, but it isn't going to be the simple silver bullet, and we have to guard against complacency. So my penultimate point is around accountability and blame. I'd be very interested to think about this in the German context. In the UK, accountability is generally associated with the distribution of blame. If you're held to account, you're usually in trouble. And that reflects the rather adversarial, rather masculine, rather aggressive nature of our political system. As soon as COVID happened, and as soon as the Prime Minister pledged that we would have a public inquiry at some point in the future, reflect upon how we did take on the challenge, it was almost as if a shadow has hung over the policymakers and politicians, as people are very wary about whether they will at some point in the future be the scapegoats for COVID. And I think this accountability and how we've not been able to approach accountability with a policy learning perspective, but with almost a sacrificial fear factor, has been really important. And then I'll finish very quickly now with the final issue, which I think is a perfect link to thinking about Germany. If there is, I would say, a contrast, it's almost too obvious for me to comment upon. It is this issue of leadership. It took a long time for Boris to come to the topic of COVID. He missed a lot of the early COBRA emergency planning meetings. He had a lot of issues on his plate. Not only did he get COVID and nearly die, he had a new baby, a new partner, a divorce. He was trying to deal with Brexit. At a personality level, and this isn't at all political, if you read any of the multiple biographies of Boris, this is a leader who doesn't do detail, who has a short attention span. And in fact, you might argue, or maybe the public inquiry that I just mentioned will argue, that what we needed was more of a calm and competent leader, one who didn't make lots of usually not very appropriate jokes. And when I think about calm and competence and leadership, I think of Angela Merkel.
Thank you very much, Matthew. I'm looking forward to hearing what Anna will tell us now about the competent and calm government of Angela Merkel. So the floor is yours.
Okay, thank you very much for the introduction and the invitation to this event today. Yeah, so in public and private conversations in Germany, as elsewhere, this COVID-19 pandemic has been haunting us since at least March 2020, and I guess it will continue to do so. Actually, I hate to say that not even the impending end of the Brexit transition period and the prospect of a hard Brexit have been very successful in replacing COVID-19 headlines here in Germany. Actually, only the US election gave us a kind of a break from the 24/7 shower of news, statistics, and this how to remain safe, sane, responsible, and creative during the pandemic media reporting. The way the German government has responded to this novel coronavirus has met with considerable interest outside Germany, and I just realized that also in the talk that Matthew gave. And that was particularly because we had rather low numbers of a low number of fatalities during the first spike of coronavirus infections in March and April 2020. So I guess it's safe to say that among major Western countries, Germany's performance has been exceptional. And I've actually heard many friends, family members, colleagues here in Germany that they said that they feel they are in the right place in the face of this emergency. Actually, Matthew, you prompted me to respond to the leadership issue, but actually I wanted to highlight 4 reasons for this German exceptionality that go beyond political leadership as a decisive factor. And maybe we can talk about this in the Q&A later on. So I'd say, first of all, it's due to the centralization of competencies at the federal level and actually also a steady expansion of executive powers in Germany. You hear it very often in policy analysis and media reports that the German government's effective response to the pandemic is astonishing because of Germany's multi-level system with a strong power sharing between the federal states, Bundesländer, and local levels. We have seen numerous struggles between the federal government and state governments, so-called Länderregierung, over restrictive measures, particularly in the past few weeks. But actually, we've also seen amendments to this so-called Infektionsschutzgesetz, Infection Protection Act, since March 2020, that clearly signal a power shift towards the federal government. So it's still our parliament that decides if we are in an epidemic situation of national extent. But in case of such a situation, there is now an amendment to this law that contains a so-called general clause, and it gives particularly the Minister of Health ample powers to execute and oversee pandemic measures. That includes travel restrictions, quarantine measures, the procurement and distribution of drugs and medical equipment. The second reason for why Germany has fared well in comparison with other European or rich countries is its bulging wallet, I'd say. So we had a brimming treasury that has allowed the finance minister to generously fund redistributive measures such as short-time allowances, compensation for parental leave due to closed schools, compensation for freelance workers, small businesses, etc. And I just learned today that it is estimated the pandemic has already cost the federal government 50 million euros of tax money. Third, what's often mentioned is the robust German healthcare system, and I also think it has overall navigated the corona storm quite well, notwithstanding that we also had major issues regarding elderly people's homes, for example, many of whom failed to adequately protect their residents. And as we see right now, the test and trace strategy of the government has quite quickly reached its limits, with overwhelmed district health offices and laboratories, shortage of staff and supplies. So right now it's already projected that hospital capacities for patients in ICUs will be in large parts due to shortage of staff. And finally, I would argue that Germany's public policy in the face of the pandemic is noteworthy for the highly effective public communication strategy by key actors in politics and science. So a strategy that has for a long time, and I will go into detail in a minute, for a long time succeeded in presenting policies as rational, without alternative, and proportionate. Already in 2014, the German Ministry of the Interior has issued guidelines for crisis communication, no matter what kind of crisis, in which it lays out a detailed plan for communicating internally, also communicating with the German populace and media, as well as communicating through social media. And one of the things that struck me particularly about these guidelines is that it specifically spells out that the government wants to maintain a Meinungshoheit, which is a control over public opinion in order to ensure maximum support and trust by the population, and also in order to ensure social cohesion. In my view, the efficient and consistent way in which the government and its scientific advisors have explained the evidence underlying their policy choices and also communicated their necessity to the wider public has secured, by and large, the trust of the majority of Germans in their political leaders. And the success of this communication strategy is reflected, I guess, also in a sustained strong popular support for those most heavily involved in pandemic politics. So our Chancellor, our Health Minister, Jens Spahn, or our Minister of Finance, Olaf Scholz. And this is at least what is shown in the Deutschland trend. This is an opinion poll that's widely noted in Germany. But where are we now in terms of public support for restrictive measures and in terms of trust in policymakers in Germany? The longer the pandemic continues, and as already predicted in March, in the face of an even more worrying surge of cases in the global north, we can observe also here a growing restlessness and even a little bit of helplessness in policies confronting this health emergency. So crisis fatigue, frequent protest events against the personal sacrifices that are required to protect public health and to save lives. These phenomena unite countries such as the UK and Germany, but we've also seen them in Spain and Italy and the US, to name just a few. I do not only conduct research on health policy and global health governance, but also more broadly on colliding norms and values in politics, particularly international politics. And I would argue that the COVID-19 pandemic reveals itself as being a magnifying glass for such collisions. We have David Easton's infamous definition of politics as the authoritative allocation of values. And that, of course, also means often a hierarchization of values. And I think this definition is particularly relevant as a frame for understanding current debates over appropriate responses to the pandemic. No matter which country we speak of, and I think this is something that unites Germany and the UK, pandemic control policies face difficult decisions on hierarchies between three core values: liberty, security, and welfare. So state leaders, governments, parliaments, and the judiciary are working hard in order to ensure that measures taken to control COVID-19 remain proportionate and just, and that they produce as little negative externalities as possible. A typical policy response during emergencies and crises is to catapult security, and in our case, it's the protection of individual health and lives, to the top of the value hierarchy or pyramid. But the longer these emergencies last and the more pressure grows to switch from crisis to normality mode, the more we see contestation of these value hierarchies. So what we are observing right now in German media discourse, but also in the scientific base, or among groups that feel underrepresented in pandemic policymaking, such as young people or women, is a slow but steady rupture of the supposedly strong consensus on the appropriate response to the pandemic. And this rupture is, for example, also expressed in battles between medical associations over framings and strategies. And that is not only strategies to contain the virus, but also kind of more long-term or mid-term strategies to ensure that major parts of the German population remain on board and continue to endorse pandemic politics. What we can also observe right now in the face of often prolonged and unseen executive powers in Germany as elsewhere is that at least in democratic political systems, the voices grow louder that demand parliaments to legitimize executive decisions. So my political science colleague Wolfgang Merkel or our former constitutional court judge Hans-Jürgen Papier both stated recently that they perceive a dangerous depoliticization of the pandemic in Germany, a loss of power for the parliament and a rebalancing of power in favor of the federal government. And actually just today, the German parliament, the health committee of the German parliament has heard legal experts who have rejected further executive powers to be added to this Infection Protection Act that I just mentioned. They caution that a new paragraph would have to be approved by Parliament, and also that its language is not sufficiently clear. It was also the scientific service of the German Parliament in October that called for a strengthening of the Parliament vis-à-vis the executive. And what we've also seen here in Germany, and I'd also be curious to hear about the UK, is an avalanche of court proceedings and rulings, many of them endorsing restrictive government measures, but many of them also reversing these measures concerning church services, schools, restaurants, tourism. And actually, it is my opinion that the judiciary has become, at the moment, the major power corrective to the executive. While the German Bundestag, or parliament, has been largely invisible, and while media reporting has, to a great extent, endorsed the government's pandemic policies, rather than presenting more controversial opinions. I talked about public support and trust earlier on, so we can currently observe a mood swing in Germany, which is also reflected in the fact that support for contact restrictions and closures of facilities is diminishing. We still have 79% of people just last week supporting new restrictions that enter into force as kind of light lockdown, as we now call it. But in April 2020, when it was really severely we experienced really severe restriction, 93% of Germans supported these contact restrictions. And what we also see in more recent polls is a great variation in popular support for restrictive measures. So there's a more differentiated picture in terms of how rational and also how just the German population finds specific measures. Actually, the great majority of them tend to think that we can live without bars and pubs for a while, but not without sports, restaurants, or cultural facilities. And we can also see a growing concern for the disproportionate effects of certain restrictive measures on some economic sectors, particularly culture. So to conclude, and I haven't talked at all about this week's breaking news on the vaccine, what I predict is that once the time has come to start a massive rollout of vaccination, public debate and controversy will shift from fairness questions surrounding the restrictions to questions of fair and equal distribution of vaccines. Thank you for listening.
Thank you very much, Anna and Matthew. That was really fascinating. And I'm now inviting everyone to send in their questions into the chat, and I will then read out the questions and put them to Matthew and Anna. But maybe I may start with a first thought. And being German, living in the UK, I was very much struck by the reaction by the British public. If I compared it to Germany, say in the first wave, so in the spring, and it's actually been like this even now. My impression is, Matthew, that in Germany there's a much more fierce debate about restrictions by the government, curtailing basic rights and so on and so forth. And as Anna just said, the role of the judiciary. So, for example, every day you have court cases in Germany now which say, for example, today, I think it was in Bavaria, that it is not right to close down all the gyms. So gyms have to partly open again. So the reaction in the UK by institutions, but also by the public, have been far more passive, I think. And I would like to have your thoughts why this is the case. Why actually I was expecting, being a foreigner, far more protests in the UK against the measures. And it was especially in the first wave, I was astonished by how much people were following the guidelines and sticking to the rules. Thank you. You need to turn on your micro.
Sorry, yeah, I think it's a really good point, and I think it demonstrates not only very different political cultures amongst the public, but also the different constitutional frameworks. The British political culture has a long-running emphasis on muddling through, and in many ways, if you were to sum up the British approach, I'd call it muddling through, and muddling hasn't really worked that well. The first lockdown, yes, people were much more compliant. What was really interesting about the first lockdown, though, was it showed that it's much easier to lock down quick and hard than it is to release lockdown slowly. It was almost as if as soon as the first lockdown was released, there was a big rupturing. Younger people flooded the parks and the beaches, and there was no controls at all. And the police gave up. They admitted it. They couldn't control things. And yet older people who remained very scared tended to stay at home and not even go to work. So there was a very interesting contrast there in the generational approaches, which I think has been a big issue. The interesting thing about the courts is we have a famously political constitution. We have a Supreme Court that isn't really supreme. And actually, it isn't, again, part of our political culture, I think, to think about going to court in the UK in the way it might be in Germany. So the court hasn't been a major arena yet around COVID cases. And in fact, one of the interesting things is, again, going back to Brexit, of course, the government is still smarting from the Supreme Court case about the proroguing of Parliament being illegal. The government now has a commission out reviewing the power of the courts and the reach of judicial review. So there is clearly a sense of mood music that I think the courts know that the case in Brexit and the Miller case was exceptional, and almost I think there's even a sense of they have to be very well behaved, and a lot of concern about what will come out of that official review.
Yeah, thank you. And if I may follow up briefly and with a question to you, Anna, this struggle between the federal government and the lender, is it actually, the impression here is that in the end, Angela Merkel always managed to bring both sides together. Is that still the case? And this tension, this new kind of tension, what does it mean for other political crises in the future, you think?
Yes, I would agree that in the end there was always kind of a compromise could be found between the lender. We've had some Bundesländer who've kind of raised their head very often in responses to the pandemic, and that's not very surprising. Bavaria and North Rhine-Westphalia, where there's also like a leadership struggle going on. And sometimes you also had the feeling that they were kind of pushing other Länder to also go to their extremes. But it's also because these Bundesländer had a very high number and still have very high numbers of infections, the highest actually. But interestingly, particularly the Länder more to the west of Germany, have been able to find a compromise. The Länder in the east of Germany, like Sachsen-Anhalt, particularly Mecklenburg-Vorpommern, I don't know the wording in English, the translation, but they still have a much less dramatic situation with regard to particularly in the rural areas. So there have also been tensions on this level, not only tensions between different groups in the population, we have also this intergenerational aspect that Matthew mentioned. That interests me also a lot, how young people are actually perceived in the pandemic. But we also had this East-West confrontation in terms of that Eastern countries, Eastern Bundesländer governments actually thought they were overly restricted despite very low infection numbers. So, and in terms of where the tensions will lead, just very briefly, I think Matthew mentioned also the first lockdown. I think it was unprecedented. It was something that none of us has ever experienced. And the longer we go, the more maybe impatient we also grow, and the more maybe also the greater our expectations are also towards the government to really kind of manage or to have a foresight or to have a long-term plan. How can we get out of the situation? So, and I think that adds up to this restlessness and maybe also the fatigue that we are experiencing right now.
Thank you. There are a lot of questions coming in. I'm very pleased. The first one comes from Peter Barnes, and he's asking a very important question, the question of the week, obviously, which is the vaccines. And his question is whether you think that this will lead to greater international cooperation or more national approach in policy making. I don't know who wants to start answering.
My own sense is that although I would love to think it would lead to more international cooperation, I think it's likely to lead to a slightly more nationalistic focus on making sure that the governments of different countries want to make sure their publics have first dibs. The big issue for me, interesting enough, comes from the issue in Germany. In Germany, the debate may well emerge around the fair and equal distribution of the vaccine. Funnily enough, the debate in the UK is not interested in that. The debate in the UK is how many people are going to be anti-vaxxers and not take it? So it's really interesting that we don't have that equity debate yet.
Yeah, I share Matthew's prediction that, I mean, also we've already seen even prior to the vaccine being available, we've seen this first come first serve attitude. That didn't only apply to the vaccine, also apply to masks and disinfectant and whatever. So I don't have much hope that there will be a very that the solidarity norm will be much driving the international response. And all the more we would also need to talk about the global south and the way that it is affected by the pandemic in sometimes very different ways than countries in the global north are affected. So they have, many people talk about, they have multiple pandemics going on at the same time, malaria, HIV, and then kind of COVID-19 on top, which doesn't appear to be the most pressing health issue, in fact, hunger, malnutrition, etc. So, I mean, taking these things into the picture when we talk about international cooperation and solidarity, I think makes it a very frustrating exercise to think about what will happen.
The next question comes from Paul Ferrelli, and he's asking, which I think both of you can answer from a different perspective. Maybe you start first, Anna, about what is the perception in Germany of the Brits having, and I quote, having been typically amateur yet again in our COVID response. I guess Paul is also referring to the perception of Germany, how Brexit was handled in the UK or by the British government. So he says, for example, for instance, the Robert Koch Institute, which has been widely praised, working with the Länder, while the Public Health England, which is kind of the equivalent to the Gesundheitsämter in Germany, they are now actually being broken up in the middle of a pandemic. So Anna, how is, from a health expert's view, how do you see the pandemic being handled by institutions in the UK?
So actually, I don't have that impression with the amateur. Of course, at the level of political leadership, I totally agree with the image that was drawn up by Matthew about that this kind of very confused head of state and the way he kind of, I don't know, muddles through this crisis. But as someone who does research, university research on issues of public health and global health, I can say that this is not a field that Germany is very strong on. I mean, we have the Robert Koch Institute, and it has also through this pandemic really grown in size. It's being like a lot of money is pumped into this institute to make it also fit for its role. So we look to the UK very much in awe, and also with a lot of respect, and with its strong tradition in public health research and global health teaching and research, and very good advisory expert bodies that we try to copy in Germany, actually. So trying to build our own tradition of, or our own field expertise in global health.
Matthew, would you want to?
There?
Yeah, of course.
So let me just chuck a couple of things in, which I think move on from that. I think there's a question to be asked around, you know, COVID is obviously a new virus, but the existence of global pandemics is not new. And what is very interesting about the UK case in particular is that, as happens around the world, governments will run preparatory crisis resilience training courses. And in the UK a few years ago, we had one called Operation Signet that was based around, are we prepared for a major global pandemic to hit the UK? And what this Cabinet Office exercise revealed was that we were completely unprepared. What's interesting going on from that is that nothing happened, because all the senior officials that would normally then have taken responsibility for improving the capacity of the state in the areas that have been identified as weak, they were all redirected to Brexit issues. And that is a real key issue, which has really caught us out now, that, as I said before, almost as if our state structures were to some extent looking in the wrong direction and underpowered. And just to the issue about leadership, it's really important for people to understand. Boris Johnson is a libertarian. He doesn't believe that the state should tell anybody what to do. He doesn't believe the state should have any interest in where people go, what they do, or anything. For Boris, this is the worst way of being a prime minister, having to put people into lockdown that he can imagine. And also, Boris doesn't like giving people bad news. He needs to be loved. And often what he does is he just disappears. He disappears. And that has become even more clear as the COVID issue has gone on.
Thank you. The next question comes from Peter Watkins, and maybe that's more a question for you, Matthew. He asks whether given the British geography, topography, wasn't a more regionalized approach to restrictions inevitable in the UK? What was missing was a coherent framework within which variations could take place. Are there lessons from Germany here?
Well, I mean, that's a great question, and I'm really interested from learning what I have about what happened in Germany, because I don't actually think that what's happened is that the English regional government or devolution has proved to be the answer. I think essentially, you know, Great Britain is a 900-mile long island on the outskirts of the Northern European mainland. It's relatively small. And what we've had happen is lots of debates from different areas saying, well, why should I be in lockdown? Why should I be under pressure? Because we haven't got as high a breakout as 10 miles down the road. And in many ways, I think what's been needed was a clearer, more central capacity to set the ground rules. And that's just never been in place, which appears from what I've learned about Germany, that the federal government did almost suck up those powers to increase that structural capacity.
The next question kind of follows that up and goes to you, Anna. We talked about the tensions between the federal government and the Länder, but have there been tensions between the Länder?
Yes, of course, there have been tensions. I already mentioned that obviously the pandemic is not happening outside like power struggles and leadership struggles, for example, in the governing party, in the Christian Democratic Union. So we have had tensions between those people also in the government who are actually aspiring to become next chancellor. So we had tensions between Markus Söder in Bavaria and Armin Laschet in North Rhine-Westphalia, and these also played out, and that one of them was trying to be less restrictive, or the least restrictive in some measures. For example, in schools, the mask wearing in schools has been a major issue, a major contentious debate, and Markus Söder in Bavaria trying to be like to play the strong boy, and even though in Bavaria also many things were actually going quite wrong. So, and then I already mentioned there have been tensions between the East German Bundesländer and the West German Bundesländer, also over this kind of disproportionate situation, or the differences in the situation. And then the East German Länder felt it was unjust that they had to undergo the same kind of severe restrictions.
Thank you. I should have said that last question came from Claudia Hamel. So the next question is from Anne Hield. She's asking about the reason that there have been such a high mortality death toll in the UK. It's maybe not only to the virus going very quickly, unfortunately, into care homes, but actually to the generally poor state of health in the whole country. Matthew, would you agree with that?
Yeah, I mean, that's a really good point. There's no doubts about it now. The data shows that when COVID started, and particularly when Boris was hospitalised, there was a certain public narrative that this is a great equaliser. If the Prime Minister can get the COVID and be ill, then anybody can. And actually, that's rubbish. What has actually happened is that COVID has replicated pre-existing structural inequalities within society and has ravaged amongst certain communities far more than it has amongst different wealthier communities, quite simply because they tend to, those people tend to be healthier and wealthier and have more support around them.
I just read today in The Guardian that by now there is like overwhelming evidence, like a number of studies have been conducted that show that Black and Asian people in the UK are, I don't know, 3 times more likely to also get severely ill with COVID. And that's, of course, also due to the fact that they live in very constrained spaces, that they have precarious work where they have to go take the tube to work, like in the front lines in supermarkets or wherever. And it was quite overwhelming evidence that I read about that. That may be also an interesting read for the person who asked this question.
The next question comes from John Kampfner. Some of you might know him or his book, the book he recently published with the title Why the Germans Do It Better. He's asking Anna, what does Germany do with its success? As I have written, John says, Germany's comparative success on COVID demonstrates a much wider political competence and social trust. And yet, when asked why Germany has done so well in the pandemic, many experts and politicians refer to luck, something I dismiss as too easy. In short, do you think the COVID success will increase Germany's broader self-confidence in terms of acting as a more assertive force for the good in future crises?
Thank you for this excellent question, and I look forward to reading more, to reading the book and more publication. Actually, as I gave some reasons for this exceptionality of the German response, and luck wasn't one of them. So I would totally not share this this conclusion that it's because of luck. And I already mentioned the factors that that may explain why Germany has done so well. And in terms of what does it do with its success, I mean, it was aspiring to become a major leader. Germans don't like that word very much, also because of our history, but a major leader in global health. I've written a paper in the Lancet with German colleagues on the German engagement in this field, which started with the its G7 presidency in the early 2000s. And actually, I think it will build on this kind of success, and it will build it's building up its expertise in this field even more now during the pandemic. So I'm pretty confident that we will see also in the context of the World Health Organization and the European Union, where we've already seen that Germany has been very active also in trying to, for example, fortify multilateral responses to the pandemic.
The next question comes from Richard Jagert. It's actually to Anna and to myself, although I'm actually the chair. I actually don't want to answer any questions here, but he's asking if you could talk some more, and I think we've touched upon that already, on the impact of the Länder response to the pandemic and the impact it is having on the candidate's position in the CDU leadership contest. I mean, this is a really interesting question because, of course, we have Armin Laschet, who's the Prime Minister of Minister President of North Rhine-Westphalia, who is a candidate to succeed Angela Merkel. Then we have, of course, Jens Spahn, who's actually not a direct candidate, but is in a kind of duel with Armin Laschet. And then we have the dark horse Markus Söder in Bavaria. I must admit I haven't followed this too closely lately, but what I found surprising is that now everybody wants Angela Merkel to stay. I don't know what, Anna, is that the truth?
Well, you forgot Friedrich Merz, who I don't know if you follow German media, but there's a very ambivalent reporting about his kind of, that he's kind of pissed off, I don't know if this is the right word, about the way he's treated in the media, and that he really wants to be the candidate for the chancellery. And so that there's this kind of, all these conflicts also surrounding the pandemic. And just, I mean, Matthew mentioned Christmas. So today I read that Armin Laschet is, and I find this a bit, or maybe not a bit, but quite populist. So he's now planned to prolong the Christmas vacation for kids by 2 days. So they already start on 19th of December. And with the kind of a promise that then families can come together and celebrate Christmas, which I find quite daring, to say the least. So we are seeing like that there are plenty of registers that these candidates are drawing upon to kind of, I don't know, win over the hearts and minds of people.
Can I jump in there?
Of
I
course.
think there's an interesting comparison with the UK that COVID has also changed the tectonic plates between the parties, but also more importantly within the Conservative Party. We were talking briefly about structural inequalities and the way that COVID has hit different communities different to others. And the big issue there is that we have a Conservative government who's in power because they were able to win seats in the north of England, which isn't going to be their normal constituencies. These are good, hard, industrial, working class seats, which are now held by the Conservatives. So the government is committed to this levelling up agenda, but that has been very much distracted by COVID. And more closely to home, Boris Johnson is increasingly being held against somebody that a year ago nobody had heard of. So Rishi Sunak, the Chancellor of the Exchequer, he is the person that people are increasingly looking to for that competence, clarity, and attention to detail. So it's fascinating.
Thank you. Lots of questions. Only very short time left, so I think we need to speed up a little bit. The next question comes from Andrew Gilchrist. He asks whether both commentators could reflect on the degree to which there is an easy cooperation or not between the government and private companies in tackling the pandemic.
Shall I go first? The simple answer is there wasn't any easy cooperation in the UK. When we first needed to reach out and increase our testing capacity, there were huge numbers of private companies, research and development labs, universities that all had spare capacity that they offered to the government. The government insisted on using its public health laboratories, and the ability to coordinate across the public-private boundaries, or even with the arm's length universities, it just didn't ever seem to happen.
The question is interesting. It's also quite broad because it doesn't specify what kind of companies. So Matthew was talking about the kind of the biomedical sector, and I think here in Germany, this machinery is running quite smoothly. I think particularly the Merkel government obviously maintains very strong and close relationships with private companies, and obviously we have also a strong public research sector that's very often well integrated with private companies. So in the outskirts of Berlin, for example, we have this Adlershof, which is like a huge kind of a small city where university research labs are kind of door to door with biomedical technical companies. But then what I find also interesting about this question is that we've had some companies, for example, I don't know, the poultry industry, I think in Britain was also for some time in the spotlight. So there were also major issues about not enough government control over certain industries, seasonal workforce, massive outbreaks of COVID infections in these kind of shelters for these workers, etc. So it has also, at least for some time, triggered off a renewed discussion on also the companies running elderly people's homes. I've read horrific reports about the UK, actually. So we've had a new debate on more government oversight over what some companies actually, how they negatively contribute to the pandemic.
The next question is a rather philosophical one. I think we could spend a whole night talking about this, but Wolfgang Meyer asks, COVID as a magnifying glass of culturally determined norms and values. Brits meet Germans in being different in their approach to suffering and death. Very interesting. What would you say to that?
Let me just hit that very quickly then. I think it's a really incredibly fascinating question. Brits don't do death. We don't talk about death. We avoid it at all costs, even amongst our closest friends and families. And what's really interesting about how the government has handled COVID is obviously COVID is a particularly age-related illness. 95% of the people that have died of COVID have been over 70. But we have not had the maturity as a country yet to have an honest debate about whether we should be putting such huge investments into maintaining the lives of people who are already towards the end of their lifespan, even though that is going to have massive costs on future generations. So it's an interesting intergenerational debate, but at the moment, we're not in a place to have it.
So that's more the Swedish position, I think. But it's interesting because I've been living in the UK several times, so in total for more than 4 years. And I always had the feeling that the Brits are much more kind of organic in the way they handle suffering and death. So that's interesting that you have this perception, because I have the feeling that, or the impression that the Germans are terrible about talking about death or dealing with death in terms of that, like how funerals are organized or where people can get buried. Like these are all symptoms of like an angst about confronting death. So it's interesting. So maybe we have more in common than I think.
Well, we have our stiff upper lip.
That's true. The next question comes from Caitlin Roberts, and she asks, and I think that's a question for Anna, to what extent do you believe that COVID has had an effect on education, and how the various Bundesländer have dealt with this? Big question, especially for mothers, I think.
Yeah, so I have 3 kids and 2 of them are in school. So I'm witnessing this every day, even though they are in school right now, in a kind of a normal mode, but it has definitely had big effects on education, and we've already had some studies that have shown that, and I think that's the same in the UK and everywhere in the world actually. People from children from poor, deprived households have been suffering disproportionately from the closure of schools, and also children in daycare facilities, that it has really affected them. And what we've also seen, I mean, Matthew, you presented Germany as we were so prepared for this kind of crisis and pandemic. And actually, in many ways, we can also see that we haven't been very well prepared. So the digital infrastructure for teachers and for pupils to do this remote learning is terrible. And I have the fear that we will soon enter again like the homeschooling season, and nothing has improved really. So and I think yeah, the more often this repeats itself, the more drastic the effects on educational attainment will be.
But Anna, just very briefly following up, has there been any discussion whether some Länder perform better than others?
No, not that I can think of. It was more treated as a German-wide issue, for example, this digitalization. And I mean, I think that has also to do with the fact that schooling in Germany is I think 90% or so is like publicly funded schools through tax money. So almost all kids in Germany go to these public schools. We don't have this kind of private sector. And that, yeah, so I haven't really seen any debate on if some Bundesländer fare better than others. It's more that some schools fare better than others because their district is maybe a little bit richer or handles the situation better, but not between the Länder.
Okay, and I'm afraid that's almost the last question we can get to, which is from Dietrich Hauptmeier on the centralization. Is it maybe the case that Germany led centrally but delivered locally, whereas the UK tried to deliver centrally as well, given distrust between central government and local government? I think this is a really big question for the UK, the distrust between Whitehall and the rest of the country and the effects of that, Matthew.
Yeah, I mean, I think it's a very good question. There's no doubt that although we have a government with a majority of 80, most of the metro mayors that the Prime Minister and the government were trying to deal with at a local English level were Labour Party mayors. And there isn't a great history of positive relations between local and central government. And what's also interesting is that the regional big city mayors were created to deliver a stronger voice and an ambassador for the English regions on the basis that devolution Scotland and Wales needed to be equalised up. And the big regional city mayors have come into their own under COVID as the main lightning rod through which big regions of England push themselves back against the government and where the government goes to talk to those regions. And that is not going to change after COVID.
Okay, I was just told that we are allowed to ask one more question. So I'm going to Matan Mohan Yaganathan. Is it not more of a judgment in hindsight while evaluating the government responses to the pandemic crisis? One gets an impression that any government amidst the crisis, the UK in particular, is disproportionately criticized. Should we be not focusing on larger political and social structures than getting embroiled in an episodic analysis?
Well, I think this questioner must be a political scientist with the episodic analysis. It's a good question. Yeah, I mean, there's always a trade-off between focusing on what are essentially case studies of different challenges and crises vis-a-vis the broader structural, systemic, embedded structures. I still think there's also a good case to make. I mean, what's very interesting is it's very easy to criticize, and particularly the media believe that only bad news sells newspaper or website space. And in fact, if you were to look back, I mean, I'm not one that wants to particularly speak in defense of Boris Johnson or the government, but actually what's interesting, if you look at the scale of how quickly the government did step in to intervene and push the state and the particularly economic support structures, at the moment the state is supporting something like 5 million working people. The scale of the state expanding in the wake of COVID very rapidly has been massive. We had a problem with rough sleepers in the cities, which is an issue in European cities all around. But overnight, almostly, the government was able to put structures in place to get rough sleepers over 95% into hotels or temporary accommodation. So in some ways, you might argue in a more balanced way that the state did succeed, it did have success. But at the moment, we are in a situation where we are not yet, haven't got enough distance to see what worked and what failed. And what we do have is every day now, what we've never had is this stability of the vision. I mean, I was very taken by this idea of the government guidance and control over public opinion in Germany. In the UK today, obviously, the Prime Minister's chief communications person has quit. And, you know, they've had a real tough time trying to send out a clear message.
I think this is a very good question. It really kind of speaks to me somehow, because I'm very often puzzled when I hear people say that the virus causes the epidemic or the pandemic. And I think it's not the virus that causes the situation, but it's and as you mentioned, the political, social, and particularly the economic structures that it or like the fertile ground that it falls upon. And I'd say that also, I mentioned it, there has been a lot of success, and the German government has been very good also in mitigating the economic kind of shock or the economic hardship of many people. But then again, it's a magnifying glass that kind of puts a finger into the wound, and it shows to you, for example, we haven't talked at all today about refugee homes in Germany. We haven't talked so much about, as I said, the elderly people's care or seasonal workers. We also have, for some people, horrific working conditions in Germany. And these are situations that drive the pandemic. We've seen this in North Rhine-Westphalia, for example. And therefore, they're also situations that are very consequential for us, because we then are like people, everyone has to kind of undergo restrictions in their context, etc. So, and therefore, I think your question is very pertinent. And it's also a question that speaks to any social or scientist or economist who also has maybe something to say about why we are in the situation that we are now, not just because of a virus.
Thank you. That was, I think, very good last words. And I think, Antonia, you wanted to come in. Yeah.
Yes, thank you very much to Stefanie Bolzen, Matthew Flinders and Anna Holzscheiter for joining us today and for sharing their thoughts and insights with us. And thank you very much to everyone in the audience for dialing in and for asking such interesting questions. To those of you who are new to the BGA, we hope you enjoyed this evening's discussion and would like to encourage you to become a BGA member. If you're interested in more events like this, we have an upcoming online event on the 24th of November with best-selling author Thomas Harding and chair of the Jewish Museum London, Nick Viner, to mark the publication of the picture book version of Harding's Costa shortlisted book, The House by the Lake. In addition, we have a very exciting BGA Christmas quiz coming up in December, so do stay tuned, keep your eye on your inboxes for more details over the coming weeks. So on that note, thank you very much again to our panelists for joining us tonight, and I hope you all have a very good evening.